Jay, you're 2 months in and your blood pressure is down to 128 over 86. Yes, yes, yes. That's what we want to see. Great job, Jay. You guys, this is what it's about. It's about trying to get off of the prescriptions, about trying to need not so many prescriptions in our life and getting true health and wellness. So if you've never met me before, my name is Dr. Jen. I'm a pharmacist and diabetic educator. And I got an email yesterday or the day before all about prescription drug prices. And they were talking about the tariffs. And they were talking about how tariffs are going to impact the price of medications. Now, as you guys probably know, prescriptions here in the United States are rarely from the United States, especially the generics. Most of them are made in China. You may not know that, not working in a pharmacy, but let me tell you, a lot of medication comes overseas. Very rarely are things made here in the US of A. It is rare. Yes. So I was reading an article just this morning that was talking about the tariffs and how they estimate that prescription prices in 2025, if these tariffs are here to stay, $50 billion increase in the medication costs here in the United States because of tariffs. Now, I'm not on here talking politics. Tariffs, they can come, they can go. You know, it's not my job to decide the fate of America, right? If they're here, we have to deal with them. Prescription prices in the last 10 years have gone through the roof. Then we're adding an extra $50 billion because of tariffs. Okay, let me explain this to you real easy, guys. You can't afford to get sick. You can't afford to have high blood pressure. You can't afford to have diabetes. You can't afford to have dementia and Alzheimer's. You can't afford to use the weight injections all the time. You guys cannot afford it. No one can. If you guys are making crazy money that you have nothing else to do with, but then throw it at the doctors and at the hospital and at the meds, go for it. I'm not doing that. I am not going that route. You guys can get good health and wellness in your life. For instance, the GLPs. We hear about the GLPs all the time. Glucagon-like peptide injections. Okay. Food, did you know? Healthy food naturally raises your glucagon-like peptide. So if you eat protein, if you're eating healthy fats, you're eating nuts, you're eating fish, you're eating avocado, you are naturally going to raise your glucagon-like peptide hormone and not be as hungry. What do you think is more cost-effective and better for your health long-term when you're talking about side effects, co-pays, doctor's visits, the interactions, all the other things that go on when you're taking a medication? Eating an avocado every day or using an injection? Think about it, you guys. What's going to be more cost-effective for you long-term? Which one helps with your mental health? I also read an article last night about the number of people who use a GLP injection and within 2 months go to the emergency room for a psychiatric event. So they're still in 2025 fighting and debating over what this does to your mental health, and we don't know the side effects. That's just it. People who are currently using them are the ones that are getting tested. You are the test dummy. You are the guinea pig. Okay, I'm trying to be nice, guys, but it's true. That's when it comes to any prescriptions here in the United States. Yes, they do the little placebo-controlled trials that last a year. But people are using these medications for decades. The side effect profile, we don't know. And that's with any medication. They come out on the market, they do 1 year of testing, they throw it at you, and they say, best of luck. Literally, best of luck. It's buyer beware. It's, I hope it works out for you, and I hope you're going to be okay, but we don't really know until we know, right? This is why so many medications have been taken off the market. Let me explain to you, as a pharmacist, the number of prescriptions that I have seen get red flagged and then what's called black labeled and then yanked off the market. There's one called Vioxx, right? A couple years ago, completely yanked off the market for causing cardiovascular events, heart attacks and strokes. It was out there for a very long time. People were using them for a very long time. Literally over a decade, and all of a sudden they realized, guess what? Everybody's having a heart attack and stroke from this medication. They finally yanked it off the market. Unfortunately, that is how medication works here in the US of A. So not only are we risking ourselves with the side effects, not only are we spending all of our precious time in the doctor's office, in the pharmacist line, paying the copays, increased health bills, but now with tariffs and everything else going on and the economy, the drug costs are going up and up and up and up and up. Food prices still high. Who can afford this anymore, guys? You can't afford to get sick. You have to go towards health and wellness. You got to get off the medication. You got to fix the root cause of your illness. Now, can every single illness be completely relieved with good nutrition? No, I understand there's some autoimmune diseases. There's some serious illnesses. Sometimes people need an antibiotic, right? I'm not negating Western medicine completely. Sometimes we need it and it's there when we need it. What I'm saying is that if you are struggling with menopause, with thyroid issues, with blood sugar issues, cholesterol issues, fatty liver, PCOS, all of these things can be fixed with food, with changing how we eat, with cutting the processed garbage and kicking it to the curb. There is not a problem, a chronic condition out there that is you're not going to make better with good nutrition. There's not. Good nutrition is going to help you in each and every way. Taking down inflammation is not going to make any single condition worse. It can only make it better or not affect it at all. Do you understand this? So it's worth a shot. It's worth a shot if you ask me. I don't care what you are dealing with, what problems you are facing, whether it's a mental health, a physical health issue. Focus on good nutrition, the minerals that you need, the vitamins that you need to keep your skin healthy, to keep your inflammation down. Take down gut inflammation, healing things like leaky gut, kicking some of the sugar to the curb. Sugar causes so much inflammation in our body, and that causes a whole cascade that disrupts so many hormones. It's all about hormone balance. It's all about taking down inflammation. It's all about getting the minerals and the vitamins that you need. Now, are all of us a little bit different? Yes. All of us are a little bit different. Some of us are more perceptive to autoimmune disease. Some of us end up getting type 2 diabetes with just 10 years of unhealthy eating versus some of us it takes 30 years of unhealthy eating to go the same direction. We are genetically all a little bit different on the inside. Our gut microbiome is a little bit different, but good food benefits everyone. Good nutrition benefits everyone, every single time. You are not going to find a chronic disease, condition, problem that is going to be made better with Oreos, Doritos, or Pepsi Cola. There is not going to be a single one. You find the study, you find the scientific evidence, you're not going to find it. I'd love to see it. I'd love to see you present it to me. I would love it. I literally spend all day long looking through scientific evidence, going into the National Institute of Health, going into the PubMed articles, and looking for good science to help share with people. Never once have I seen a study that ultra-processed food and sugar made anyone better in any way, shape, or form. None. It's not food, guys. It's not food. Stop drinking the Starbucks lattes every day. Stop drinking the sodas. Okay, you need to lean into good health and wellness and good nutrition. Take down inflammation, heal your gut microbiome. For instance, your gut itself makes serotonin. Serotonin is a neurotransmitter that helps alleviate anxiety and depression. Serotonin is what is supplemented when you're taking Prozac or you're taking Zoloft. So let's talk about serotonin for a minute. 90% of your serotonin is made in your gut. If your gut is completely ravished, the pH is terrible, tons of inflammation because you're eating every 2 to 3 hours. The acidity is all over the place because you're eating greasy food and junk food and the fried food all the time. Do you think it's going to make the hormones that you need for your health? It's not. It's not. There's all kinds of studies. When you start working on your gut health, you improve your mental health. The gut-brain axis, AXIS, okay, is a real thing. Your gut communicates to your brain communicates to your gut. That's why when you have good nutrition in the morning, when you drink health and wellness, you get your vitamins and your nutrients first thing in the morning, that is going to signal to your brain that you're not starving, that you're not needing to go scavenge for food. This is the magic in getting good nutrition in your life. You can fix the brain chemistry. You can fix your mental health, your physical health. All of these things align. Physical and mental health align. How many people, when they start losing weight and they start getting good health and wellness in their life, they start getting some new exercise, or they start trimming down a little bit, inflammation comes down, they start getting a little bit, some good vitamins in their life, all of a sudden they feel better mentally. Mental clarity. They're excited. They're more positive. Good things are happening. Your physical and your mental health, they are right there, neck and neck, hand in hand. If you're struggling with one, you're going to be struggling with another. If you're doing great in one, that is going to lean into the other as well. Focus on good food, eggs and avocado. Wonderful studies on just eating an egg a day. Having an avocado at least twice a week can completely improve your mental health. There's been studies done in mental institutions that proved 30 minutes of outdoor exercise improves the mental health more than any antipsychotic, antidepressant, anti-anxiety medication on the planet. This is what we got to lean into, guys. We got to lean into health and wellness. We got to get outside. We got to allow the sun to touch our skin. The only way our bodies make vitamin D is with the sun touching our skin. We're like a plant. We can't survive without it. We need vitamin D. It's an essential nutrient. Can you get it from a vitamin? Yes, of course you can. You could take that vitamin each and every day. How much more beneficial is it for you to just go outside and get 5 minutes of sun? We're complicated plants. We need good minerals. We're complicated plants. We need good minerals. We need good vitamins, and we need sunshine, and we need water. People ask me all the time, how can I naturally increase my glucagon-like peptide? Water, good nutrition, and exercise. If you're not craving it now, let's get it in your life. If you need some help getting that glucagon-like peptide up so that you're not snacking and craving all the time, drink some tea with me. Naturally increasing the glucagon-like peptide for 4 to 6 hours. So I drink it for breakfast and again between lunch and dinner. It's fabulous.